Good evening students and welcome to my channel. So in my series of question and answer, today's topic is parotid gland. So these questions are just the introductory to the chapter your parotid gland. So first question is parotid gland is located. You have to give the anatomy of the you can say the location of the parotid gland, so that you must know if the swelling is arising from that area, that could be from the parotid gland. So this is first. Then second is superficial parotid gland constitute percentage of total gland. So you have to write what is the percentage of superficial parotid gland when we compare it with the total. So third is which structure divide the parotid gland into superficial and deep parotid gland. So you have to give the structure, that could be your artery, vein, fascia, whatever it may be, that divides the parotid gland into superficial part and the deep part. So fourth question is treatment of parotid abscess. So you must know the treatment of the parotid abscess, and you also must know what kind of incision and what are the structures that has to be preserved when we are giving incision for the parotid abscess. It should be a vertical incision, it should be a horizontal, and why. So question number 5 is why even small parotid abscess is very painful. So there must be some reason, because many times patient keep on moving from one physician or surgeon to another with such a big abscess, but there is a pain but not significant. But in case of parotid abscess, so that pain, even a slight increase in the size of the parotid because of the abscess, it is very painful and patient is not able to open the mouth, and it is unbearable. Even a small abscess is formed in the parotid gland. So question number 6, parotid duct is also known as an open site. You have to give the name of the parotid duct, and you have to also give the anatomical location of the opening or the papilla of the parotid duct, so that in case of some pathology, so you can be able to visualize the secretion that are coming from the duct. So in case of some infective pathology, you can easily see when you press the parotid gland, some purulent fluid is oozing out of that duct. So name one autoimmune disease in which the parotid gland is involved. So there are many diseases which can involve the parotid gland, but here you have to give the autoimmune disease. So you must know what are the autoimmune diseases which can involve the parotid gland, and what are the features of those diseases when they involve the parotid gland. So next question is 8th is stones are common in which salivary gland and why? Because as you know, the stone can form in the parotid gland, in the submandibular gland, and even the other structures like the ureter, kidney. So there must be some reason for the formation of the stone. So you have to give in which parotid or the submandibular gland where these stones are common, and why these stones are common in that particular gland. Next, 9th question is which salivary glands are salivary gland stones. Here you have to gland stones are radiolucent and which are radio opaque. So if we are going to treat, suppose a stone in the parotid duct or the submandibular duct, we have to go for X-ray or CT scan. Both the X-rays are used to opacify the, locate the stone. But if the stone is radiolucent, you will not be able to see on X-ray or CT scan. For that you have to have access to the ultrasound to locate the stone. So this is the importance, which salivary gland stones are radiolucent and which are radio opaque. If you know that this gland stones are radiolucent, so you cannot rely on the CT scan or X-ray, straightway you will advise ultrasound for the detection of the stone. Then last question is, how will you diagnose parotid gland stones? So the same question again in the different way. Suppose if you are suspecting a stone in the parotid duct or in the salivary gland, and you know that which stones are radio opaque and which stones are radiolucent. So you can easily have your access to the ultrasound or X-ray to locate the stone and to manage the stone accordingly. If the stone is radiolucent and you are trying to locate with the X-ray or CT scan, it is just a failure of investigation, because you will not be exactly locate the stone and its position. So you must know which stones are radio opaque and which salivary gland stones are radiolucent. So thank you very much. If you like this episode, please subscribe and like my channel. Thank you very much.